What is HbA1c test and what is its relevance in diabetes management?
It is also called as A1C or glycated hemoglobin test. It is a key tool for monitoring the long-term blood sugar control in patients with diabetes. It reflects the average blood glucose level for the last 2 to 3 months, measuring the percentage of hemoglobin in the blood that has glucose attached to it. Coming back to the values, the normal it has to be lesser than 5.7 percentage. If it is between 5.7 to 6.4, then it is termed as pre-diabetes, and more than 6.5, then that person is diagnosed with diabetes. Now coming back to the control, if someone has got diabetes, the HbA1c target is less than 7 percentage. But again, it might vary depending upon the comorbid condition, depending upon the age. It can anywhere by around 7.5 to 8.5, as I told you, with various conditions where the person has got.
How is HbA1c different from daily blood sugar monitoring?
They serve as a different purpose or different types of information. Let's see what does HbA1c talk about. If you really see that, it gives a long-term picture of the blood glucose control. It also assess or help in assessing the risk of complications involving nerve, kidney and then eye damage. Whereas the daily blood glucose monitoring reads the real blood glucose levels at a specific moment. For example, at this point in time, what is the blood glucose? It can be measured before or after the meals and exercise or sleeps. It helps in taking a decision, day-to-day decision, food choices, insulin doses and physical activity. It also helps in getting the hypoglycemia, that is the low blood sugar, or hyperglycemia, that is high blood sugar in the blood immediately.
How often should someone with diabetes or at risk get their HbA1c levels tested?
HbA1c is typically checked every 3 to 6 months depending upon the value. At the same time, whereas the daily blood glucose level can be done at multiple times in a day, again depending upon the treatment plan, if someone is taking insulin or with someone who has got a high fluctuation in the sugar levels.
If someone's HbA1c is higher than normal, what steps should they take next?
The right way or right approach is consult your doctor.
How much does family history or genetics influence a person's risk of developing diabetes?
Family history and genetics play a significant role in a person's risk of developing type 1 or type 2 diabetes. But they are not the sole determinants. Let's move to type 1 diabetes. It has got a genetic link, but it is more influenced by autoimmune and the environmental factors. Whereas type 2 diabetes, it has got a stronger link of genetic compared to the type 1 diabetes.
Can diabetes be prevented even if it runs in the family?
Yes, diabetes can be prevented or it could be significantly delayed even if it runs in the family. While genetics does increase the risk, especially for type 2 diabetes, the lifestyle choice play a powerful role in determining whether that risk becomes a reality.
If there is one lifestyle change everyone should start today to lower their diabetes risk,
Start walking for 30 minutes every day. That improves the insulin sensitivity, helps the body to use glucose more efficiently, thereby it lowers the blood glucose level, especially after meals. On top of it, it also helps in weight management. A modest weight loss reduces the diabetes risk. It is easy to start, no equipment required, no gym, no special skills needed for this. Hence, I would recommend to start walking for 30 minutes in a day, and then you can raise it up to 45 minutes or 1 hour depending upon your time.
winning with diabetes starts with awareness. Know your numbers. Take charge of your health.